Hi, good evening. Welcome to Friday Reading Live. My name is Vandana PS, one of the reading trainers from Neethu's Academy. Yes, I'm so excited. Do you know why? Yes, we have exam tomorrow. നമുക്ക് നാളെ exam ഉണ്ടല്ലേ? And I just want to know how many students are going to write this exam tomorrow. നാളെ എത്ര students ആണ് exam എഴുതാൻ പോകുന്നതെന്നുള്ളത് ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? Because I just want to know whether you guys are tensed. Are you guys worried about the exam or well prepared for the exam? പേപ്പർ ഒന്ന് കിട്ടിയാൽ മതി അല്ലെങ്കിൽ എക്സാം എഴുതാൻ ഭയങ്കര എക്സൈറ്റഡ് ആണ് അങ്ങനെയൊക്കെ ഉള്ളവരുണ്ടോ? Let me know that in the comment box. Yes. And today's live segment is for you guys because yes, I just want to make sure that it's not a period, I'm talking about the exam time. It's not a time to get tensed. You can do your best and get a good result. That is the only thing I can say, right? Yes. And in this video, I'll be dealing with a sample question, not a sample question, a detailed, what can I say? A self-prepared material, yes. A self-prepared material for part A. And I will tell you how this material is going to help you for your exam. ഇത് എങ്ങനെ നിങ്ങൾ എന്താ പറയുക എങ്ങനെ ഹെൽപ്ഫുൾ ആവും എത്രത്തോളം നിങ്ങൾക്ക് ഈ ഒരു ക്വസ്റ്റ്യൻ അല്ലെങ്കിൽ ഈ ഒരു മെറ്റീരിയൽ ഹെൽപ്ഫുൾ ആവും എന്നുള്ളത് ആഫ്റ്റർ ദിസ് ലൈവ് സെഗ്മെൻറ്റ് യു ക്യാൻ സീ ദാറ്റ് ദ റിസൾട്ട് ക്ലിയർ സോ യെസ് ആൻഡ് ഐ ഹോപ്പ് ദിസ് module, this particular video you can see on your screen, this material, not video, yes, this material you can see on the screen. I'll just start with the questions, but before starting with the questions, I just want to tell you something regarding what is part A and how you can approach part A in your exam. എങ്ങനെ നിങ്ങൾക്ക് part A approach ചെയ്യാൻ പറ്റും without any tension, without any worry. How can we approach part A? And the only thing which we have to do is we have to get 20 marks or we can score 20 out of 20 in part A. എന്തായാലും നമുക്ക് പറ്റുമല്ലേ, we can do that. So for that, let us know about what is the strategy or what technique you can apply in part A. And majority of the students know about that, but still minority, yes, they have no idea how to apply the strategy called skimming and scanning method into part A material. So as you know, when you sit in the exam hall, the first material you will get is part A. നമുക്ക് ആദ്യം തന്നെ കിട്ടുന്ന മെറ്റീരിയൽ എന്ന് പറയുന്നത് part A ആയിരിക്കും. And only the completion of part A, they will provide part B and part C together. There is no separate time for part B and C. Together you will get 45 minutes. So the rest, that means the initial time, which was 15 minutes, that is the only time you will get for the completion of part A. Alle? Yes. And how many questions in part A? Etra questions undavum part A il? So that in part A we have total 20 questions. 20 questions aanu, and you will get 15 minutes. So whatever it is, it doesn't matter. I'm talking about the material type, whether it is confusing, whether it is tricky, whether it is a tough material or an easy material, whatever the type of the material, you don't have to worry about it. The only thing you can apply is this strategy. Only through the strategy you will get 20 out of 20 in part A. Clear? Yes. So what is the strategy? So the strategy is called skimming and scanning method. So what is skimming and how we can apply this method called skimming in part A of reading? Okay. So skimming, which means fast reading. You can read the material fastly, as much as it is possible for you, you can read it very fastly. But see, understand one thing. Speed langa vaaichu theerkanu parayunna, it's not a task, it is a skill. That is actually a skill which you developed with your past experiences, and within these days you have developed that skill called fast reading or skimming. But what you want is, after skimming and scanning which means underlining the keywords, right? So after skimming and scanning, what you need to know is that, okay, whether I understood a summary of the text. ആ ടെക്സ്റ്റിനുള്ള ഒരു സമ്മറി എനിക്ക് മനസ്സിലായോ? Did I understand the summary of the text? What is in text A? And what does a summary of text B? And what is in text C as well as in text D? How many pictorials mentioned? And what is the importance of the pictorial there? Whether it is a flow chart or a diagram or a graph, what is mentioned there? And is it a particular disease condition they are talking about or a procedure? So what is the topic? For example, here it is Cushing syndrome. So likewise, is it a condition, disease condition, or material from regarding a procedure? So make sure that. Clear? For example, I'm just saying an example, okay, not exactly. In Cushing syndrome, maybe text it's all about what is Cushing syndrome, എന്താണ് ഈ പറയുന്ന ഡിസീസ് കണ്ടീഷൻ. ആൻഡ് ഇൻ ടെക്സ്റ്റ് ബി ഇറ്റ്സ് ഓൾ അബൌട്ട് മേ ബി ദ സിംറ്റംസ്, അതിൻ്റെ സിംറ്റംസ് ആയിരിക്കാം മേ ബി. And in text C, it's all about the result, I mean, a study regarding this particular Cushing syndrome. And maybe in text D, it's all about the diagnosis, how you can diagnose it. Or it's talking about maybe what is the treatment of this condition, what is the management, what is the administration of this condition. So likewise, in each and every text, you can see a kind of description regarding this particular, or it is connected to this particular topic. So what you can do is skim and scan, at the same time understand in a nutshell what is mentioned there. I hope it is clear for you, right? Yes. Hi Akila, Adira, Shari, Jilmi, good evening. Yes. നിങ്ങൾ ആരെങ്കിലും എക്സാം ഡേറ്റ് എടുത്തിട്ടുണ്ടോ? അഖില, ആതിര, ഷാരി ആൻഡ് ജിൽമി എക്സാം ഡേറ്റ് എടുത്തോ? ഓക്കെ. എനിവേ, so I'll just show you today how to do this materials. For example, you guys can just imagine you guys are sitting in an exam hall. So you got the material with you and you have a pencil and you guys are going to mark it. അല്ലേ? ആദ്യം തന്നെ എന്താ നമ്മൾ ചെയ്യാൻ പറ്റുക? Just pray. And take the material and skim and scan. So first of all, read the title. What is the title? Cushing syndrome. That is the title. അല്ലേ? Title എന്താണ്? Cushing syndrome. So first of all, underline the title. Okay, ഇതാണ്. Today I'm going to deal with this condition called Cushing syndrome. So likewise, you can imagine, okay, ഞങ്ങൾ മാമിൻ്റെ ലൈവ് ക്ലാസ് അറ്റൻഡ് ചെയ്യുവാണ്. Likewise, you can sit in the class, I mean exam hall, and just think, okay, so today the topic is Cushing syndrome. And the first thing which we are going to do is, we will skim and scan. How we will skim and scan? Okay, it's all about text A, B, C, and D. And I'm going to skim and scan today. So Cushing syndrome is a condition. So whenever you see a name of the condition, I mean the disease condition, you can underline that. So Cushing syndrome is a condition where your body is exposed too much for a hormone called cortisol. This can be because your body is making too much cortisol, or because you have taken a lot of oral corticosteroid medicines. If you have Cushing syndrome, it is treatable. Cortisol is a hormone that is made by adrenal glands. You have 2 adrenal glands, one sitting on the top of each kidney. Cortisol is involved in many different parts of your body. It is produced all day, especially during times of stress. Cushing syndrome is most often diagnosed in adults aged between 30 to 50 years, affects 3 times as many women as men. Children have Cushing syndrome too, although they develop it less frequently than adults. According to 2019 review, about 10% of new Cushing syndrome cases each year occur in children. So these are my keywords from text A. So likewise, you can skim. And when at the time of skimming, you can see, okay, this word is important. Why? This is a heading. This is a subheading. A name, a number, a sign, a symbol. Okay, this is an abbreviation. So likewise, you can just underline each and everything according to that order which I have told you. So what is the order I have told you? First one, you can underline all the headings. Second, all the subheadings. Third one, all the numbers. Whatever numbers they have mentioned, mark all the numbers. And fourth one, signs and symbols. Okay, so mark all the signs and symbols. Fifth one, all the names, maybe name of a disease condition, name of a country, name of a person, name of a procedure, name of a machine. Whatever names they have mentioned, just underline all the names. And the next one is abbreviations. Definitely you can write abbreviations into your answer if it is mentioned in the text. Clear? Then brackets. Definitely you can expect some kind of questions from the brackets. So brackets are always important. And whatever brackets they've mentioned, what is inside in the bracket, it is always related to the previous word or the previous sentence. And the next one is, what? Italicized or bold words. Italicized, which means it looks like slanting lines or slanting letters, as well as bold words, which means something like very attractive. So that is bold and italicized words. And the next one, the words that indicate time. Time കാണിക്കുന്ന കുറച്ച് വാക്കുകളുണ്ടാവും, like presently, currently, now, previously, during, before, after, then what else? So likewise, often, times. So underline the words that indicate time. Because why? And why you guys are thinking, okay, why should I want to underline all these words that indicate time? Because it is important. You can expect like the same questions regarding when it happened, when it occurred, when was the diagnosis taking place. So likewise, some questions can be there that is starting with when. As well as you can underline the words that indicate research, experiment related words. What are the experiment related words that you know? In majority of the materials, you can expect a lot of experiment related words like diagnosis, symptoms, procedure, prodromes, experiment, clinical, observation, then particular, what can I say, test. So likewise, a lot of experiment connected related words will be there. And research words. So what are research related words? Study, population, exclusion, inclusion, criteria, aspects, group, men, women. So likewise, a group of things will be there that includes research related words. As well as always read the first and last line of each and every paragraph, because I can say majority, I'm repeating, majority of the questions will be from the first and last line of each and every paragraph. As well as you can underline all the bullet points. It's very important. So likewise, you can underline each and everything. So then you will get an idea. Okay, ഇന്നിപ്പോൾ ഞാൻ വായിക്കാൻ പോകുന്നത് ഇതൊക്കെയാണ്. And ഇതൊക്കെയാണ് എൻ്റെ keywords. And make sure that you trust in yourself. Okay? When you underline keywords, okay, trust that, okay, these keywords will help you to find out your answer. Okay, എൻ്റെ answers എല്ലാം correct ആണ്. I mean, whatever I have underlined as keywords, this is correct keywords. Clear? Then coming to text B. Diagnosis. Salivary cortisol measurement in people without Cushing syndrome. Cortisol levels drop in the evening. This test measures the level of cortisol in saliva sample that has been collected late night to see if cortisol levels are too high. Low dose dexamethasone suppression test. For this test, you will be given a dose of dexamethasone late in the evening. Your blood will be tested for the cortisol levels in the morning. Normally, dexamethasone causes cortisol levels to drop. If you have Cushing syndrome, this won't occur. Dexamethasone CRH test. High cortisol levels can happen for a variety of reasons. For consuming too much alcohol to living with depression or anxiety. This test, which includes a shot of hormone CRH and dose of dexamethasone, can help a doctor if high cortisol levels are due to Cushing syndrome or another issue. Then petrocell sinus sampling. Blood is drawn from a vein near the pituitary and from a vein far from the pituitary. A shot of CRH is given, and if ACTH rises in the blood near pituitary, it can indicate a pituitary tumor. Similar levels of both samples indicate an ectopic tumor. So likewise, I've underlined B. Clear? So yes, a lot of comments I can see here. Yes, Shari, good evening. Josna, Anju, Shijana, yes, Srinu and Shetu, right? Okay, I don't know how to pronounce your name. I hope it is correct, right? I'm so sorry if it is not. Yes, Jilme, good evening. Shari, good evening. Atara, yeah, so that's that. Then, text C. Cushing syndrome has some unique symptoms as well as some could point towards a variety of other symptoms. Not everyone has the same symptoms. Possible characteristics include rapid weight gain in the face, sometimes called moon face, abdomen, back of the neck, sometimes called buffalo hump, and chest. A red, round face, wounds heal poorly. High blood pressure or hypertension, then excessive hair growth in the face, neck, chest, abdomen, breast, thighs, or balding. Diabetes. Other signs and symptoms of Cushing syndrome include purple stretch marks over the abdomen, easy bruising on the arms and legs, general weakness and tiredness or fatigue, blurry vision and dizziness, weak muscle and thinner arms and legs, libido changes, sex drive, and erectile dysfunction, stunted growth in children. So these are the symptoms, and symptoms can be asked in different ways, like what are the manifestations, what are the symptoms, what are the prodromes, what are the indicators. And text today we have a pictorial here as usual. It's all about Cushing syndrome. I think it's all about the management. Okay, yeah, it's all about the management. So what is the management mentioned here? Transphenodial surgery, 80% cured, 45 to 80% cured, 20% not cured, then they can go for something called pituitary irradiation. Then 15 to 55% not cured, again they can go for total bilateral adrenalectomy, 100% cure. Then adrenal tumor, surgical resection of tumor is there, adenomas cured. Carcinomas not cured, then again go for immediate mitotaine therapy. Recurrent carcinoma, surgical resection for recurrent tumor. Majority progressive, adrenal enzyme inhibitors you can provide. Cushing syndrome control. So likewise, a lot of management techniques mentioned in text D, as well as numbers. Ectopic corticotropin syndrome, surgical resection of tumor. Benign less than 10% cured, Cushing syndrome control. Malignant greater than 90% not cured, adrenal enzyme inhibitors. Indolent tumor, medical or surgical adrenalectomy, Cushing syndrome cured. So likewise, a lot of cured thing mentioned, not cured thing mentioned, and yeah, a set of surgeries as well as medicines mentioned here. That's all about that. So now just move to the question. So the first step in that, just pray and read the title, skim and scan, underline the keywords, important words, and trust in yourself. Okay, these words will help you to find out the answer. Then come to the question and read the instructions first. I know you guys know the instructions, but once again, just read it. Alright. For each question 1 to 7, decide which text A, B, C or D the information comes from. You may use any letter more than once. In which text can you find the information about? First question. So, please let me know in the comment box your answer, because it is, as you guys know, you have exam tomorrow, right? So if you want to clear exam, especially part A, it will be very tricky, I know that. But if you want to clear this exam with 20 out of 20, so just imagine if part A is secure with 20 out of 20 and rest of it, part B and part C, is just a piece of cake. Clear? So please secure 20 out of 20 score in part A, because you guys are confident, I know that, and you guys are attending the live every day. So first question, how is the identification of pituitary or ectopic tumors typically accomplished? My keywords from the question, why I'm underlining keywords from the question, because I know that the question, so don't be overconfident. Whatever it is, if you understand the question or if you don't understand the question, please do underline the keywords from the question, and those keywords can help you, or those keywords can guide you to find out the answer. So what are the keywords from the question? Identification, pituitary, and accomplished. So these are my keywords from the question, and let me know in the comment box what is your answer. ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? What is the answer for the first question? Just imagine you guys are attending your exam and comment how you write your answer there in the paper. So likewise, you can comment here so that I can check your answers. Just imagine, okay, I am the interlocutor. So yes. Hi Amrita, good evening. Yes, Elizabeth, good evening. Yeah, only 2 of you got the correct answer, right? Your name is Umi Habiba. And Akhila Aravind. Yes, you both got the correct answer, and the answer is mentioned in B, text B. So that answer is in B. And where is it mentioned? Text B, identification of pituitary ectopic tumors typically accomplished, identified. So identification about this condition mentioned in text B, and in text B already we have underlined a set of keywords that indicates what? Pituitary, petrocell sinus sampling, and through that particular test you can identify the pituitary tumor or ectopic tumor. So that is exactly the last para. Because of underlining keywords, okay, that is why, that is the reason you got option B. Sorry, not option B, text B. Yes, hi Nimmi, good evening. Yes dear, your answer is correct, which is from B. Answer is B. Second one, which diverse surgical procedures procedures are taken to address Cushing's syndrome. My keywords: diverse, procedures, as well as only 2 words I just want to underline because I didn't find these words as important for me, so I'm not going to underline those words. The only keywords which I have underlined, which is diverse as well as procedures. Yes, and let me know in the comment box, what about second question? Second question answer on the comment cheyamo. What is your answer for the question number 2? Yeah. Text D. Very good, Agila. Your answer is correct, which is mentioned in text D, dear. Answer is D. Yes, Umi Habiba, it is from text D. And where is it mentioned in text D? Suppose I'm asking, okay, where is it mentioned in text D? What will be your answer? In text D, where is different surgeries, and as we all know, text D is all about a set of management and surgeries. Some inhibitors mentioned, a lot of therapies mentioned, surgery mentioned in the first sentence, first box. So likewise, a lot of therapies mentioned. You don't have to read it, right? So answer is D. Yes, Adira Nair. Yes, very good, Adira. It's D. Yes, Shijana Nizam. Very good, Shijana. Yes, Nimi. Very good. It's mentioned in D. Yeah. Then third question. Which group is more susceptible to Cushing's syndrome according to the recent updates? So my keywords: susceptible. Susceptible, this is a very common word which you can expect in your exam. Susceptible, which means very weak, vulnerable. Easily get affected. That is susceptible. Very easy to affect that person is very susceptible. That means vulnerable, easily affected. So susceptible, recent updates. Where is it mentioned? This group is more get easily affected or susceptible. These are the vulnerable category. And where is this mentioned? Yes, Umi Habiba and Agila. Very good, dears. Correct answer. Answer is mentioned in text A. Answer is mentioned in A. In the second last as well as in the final lines, very clearly they've mentioned that set of group. Men as well as women plus adults and children. So, Cushing syndrome is most often diagnosed in adults aged between 30 to 50 years. It affects 3 times many women as men. So, see? So, that answer is mentioned in A. Then fourth one, the application of what medication dosage may result in a reduction of cortisol levels. And the keywords: application, medication, as well as reduction. So where is reduction of cortisol levels mentioned? In which text they've mentioned about reduction of cortisol levels? Let me know in the comment box. Yes, Nami, which is third one is text A. Very good, dear. What about fourth question, guys? Fourth question answer enda. What is fourth question? Application of what medication dosage may result in reduction of cortisol levels. Very good, Akila, your answer is true. That is mentioned in text B, and as you can see here in text B, where is it mentioned that level of cortisol is reducing, and that is mentioned in the first para. Somewhere here, this test measures the level of cortisol in saliva sample that has been collected at late night to see if cortisol levels are too high. So the level of cortisol, yes, that is mentioned in text B. Yes, salivary cortisol measurement, cortisol levels drop, as well as here also they have very clearly mentioned. So that is simply from text B. Yes, Nimi Shari, that is from text B. Fifth one, manifestation. Again, manifestation, which means not that manifestation. Here it is symptom, prodrome of Cushing syndrome observed in children. So what are the symptoms that it can be shown in children? കുട്ടികളിൽ കാണുന്ന ഒരു symptoms എന്തൊക്കെയാണ് പറഞ്ഞിരിക്കുന്നത്? So that symptoms mentioned in children, a lot of symptoms mentioned here. Cushing syndrome has some unique symptoms as well as some that could point towards a variety of other symptoms. Not everyone has the same symptom. Possible characteristics include rapid weight gain, dash and dash, then round face, wound, and that heal poorly. So likewise, a lot of symptoms mentioned here. So that answer is mentioned in which text? It is mentioned in text C. No. Yes. Yes, Sumi Habiba as well as Akila. Yeah, correct answers. Sixth one. What is the ratio of Cushing syndrome cases in women compared to men? Ratio, then women, men. So these are the keywords from the question. And ratio, I don't think that exact ratio like 1:3, 3:4, like this ratio is not mentioned. Ratio in the sense they have mentioned that group of people affected as well as maybe age group or something. That is ratio they have mentioned here. Women compared to men. Yeah, exactly. I didn't notice that keywords women, men. So that is mentioned in, of course, text A. So without any doubt, we can mark that. About 10% of new Cushing syndrome cases each occur in children. And in the case of this men and women mentioned here, it affects 3 times as men, many women as men. So that means it's in A. Right. Yes, Habiba and Akila. Yes, Nimi, Shari, it is mentioned in A, text A. And seventh one, under what circumstances are adrenal enzyme inhibitors prescribed? So I'm just, this is just a gentle reminder to other students. I know that majority of the students are watching this live. Please do comment your answers here, because I just want to make sure that whoever is watching my live segment, I just want to make sure, okay, my student or this person is getting the correct answer. Otherwise, I just want to correct you. So please do comment your answers here, okay? Don't be lazy. Don't be a couch potato. Clear? So seventh one, under what circumstances are adrenal enzyme inhibitors prescribed? So my keywords, circumstances and inhibitors. I can't underline adrenal enzyme inhibitors. It's there in my mind, so I'm just underlining inhibitors. So what about seventh question? Yes, Shari, Akila, which is mentioned in text D, that inhibitors mentioned somewhere here. I've seen that word somewhere here. You can provide some inhibitors. Yeah, adrenal enzyme inhibitors. It's here. So that's mentioned in D. And let me know in the comment box anyone with 7 out of 7. Yes, Atulya. Thank you so much for your active participation. Marina, Shelma, Atulya, answer is correct, which is in text D. See? Okay. So if you are participating, that means we are interested in that. If you're interested to do something, that means we will get a result. Yes. Eighth one. An increased concentration of which hormone in the bloodstream signals the existence of a pituitary tumor? So my keywords, increased, then hormone as well as pituitary, or tumor. Where is the answer mentioned? And what is your answer? This is short answer question, and the important instruction, you can write a word or a short phrase. So what is the correct answer? Yes, Akila, very good. Nimi, very good, Nimi. 7 out of 7. And what about 8th question, guys? An increased concentration of which hormone? We need the name of the hormone. Yes, very good, Akila. Answer is ACTH, and that is mentioned in, I think, somewhere in text B. I've seen that abbreviation. So yes, a very direct answer. A shot of CRH is given, and if ACTH rises in the blood near pituitary, it can indicate a pituitary tumor. So answer is ACTH. Yes, Shari, Nimi. Yes, Umi Habiba, which is from text B. Then 9th one, what percentage of patients who underwent transphenodial surgery find it unsuccessful? What percentage? എത്ര പെർസെൻറ്റേജ് ആൾക്കാർക്കാണ് just find this surgery unsuccessful? And the name of the surgery mentioned somewhere here. And what is the name of the surgery? Transphenodial surgery. It is cured, which is 80%. Not cured, that means unsuccessful, 20%. So answer is 20%. 20% from D, right? Then 10th one, in what age range are adults more commonly affected with Cushing's syndrome? So that my keywords, age range, adults, and commonly, or I am underlining affected. So what age range? When they ask about an age range, starting will be there, ending will be there. So what is the correct answer? What is the correct answer there? In what age range? Yes, Nimi. Yes, Neethu, it is 20%. Yes, Atulya, 20%. Yes, Umi, 20%. And so 10th one. Any guess? 10th question. Yes, 30 to 50. That is the correct answer. The starting number is 30 to 50. If years mentioned in the paragraph, you can write years. 30 to 50 years mentioned here. So that you can write 30 to 50 years, or you can write 30 to 50. Both are correct. Alright, and it's mentioned in A. A very direct answer. Then 11th one. Yes, Marina. Yes, Shari. Akila. It's 30 to 50. 11th one. Which glands are responsible for the synthesis of hormone cortisol? And my keywords: glands, responsible, synthesis, or hormone. So I'm not underlining synthesis because I didn't like that word. So I think I will underline cortisol. Yes, glands responsible. Which glands are responsible? Any glands mentioned there? Which glands are responsible for the synthesis of hormone cortisol? Yeah, I think this question is very easy, but a little bit confusing. Yeah, very good. And actually, Agla, your answer is right. They're asking the name of the gland here. So that it is a name you can write there. The adrenal glands. Or you can write, because adrenal and glands are separated, so it's not a single word. So that you can write there the adrenal. Both are correct. So either you can write the adrenal glands, or you can write the adrenal. I think that the is mentioned there, right? Yeah, the adrenal glands. So that answer is the adrenal glands or adrenal. Yes. Then 12th one. Melvin, it's not adrenal glands, dear. You can write the adrenal, because articles are very important in OET reading exams. If it is more than three words in your answer, you don't have to write the article. Otherwise, just add the article, the adrenal glands. Then 12th one. How is the rapid facial weight gain in patients with Cushing syndrome sometimes referred to? How? Then facial and gain. So these are my keywords from the question. At the end of the question, I don't think, or I don't find this words helpful for me, so I just underlined how, facial, gain. And yeah, how rapid it is increasing, how rapid the rapid facial gain in patients with Cushing syndrome sometimes referred to, or you can underline refer to, whatever it is. Yeah, so refer to. Another name, a very simple question, and I think answer is, without even reading the material, moon something. I don't know, I don't remember. Moon face, right? Somewhere here they've mentioned that name. Moon face or something. Yeah, moon face. So that is here. Answer is moon face. From C. Yes. A lot of correct answers. Yes, Nemi, Akila and Shetu, it is moon face. Yes, Umi, it is moon face. 13th one. Which surgical intervention for Cushing's disease showed flawless positive outcome? So, surgical and a positive outcome. So, which surgical intervention? Of course, I know answer is mentioned in text D. There is no doubt in that, right? 100%. What is that keyword? Surgical intervention, flawless positive outcome, which means 100% cure. Okay, a very good result. And that is mentioned, I think 100% result is for total bilateral adrenalectomy, right? So that is the answer, total bilateral adrenalectomy. So total bilateral adrenalectomy. Yes. And 14. Yes, Agila, total bilateral adrenalectomy. Your answer is right. 14th one, prevalent facial discoloration observed in the individuals with Cushing syndrome. So prevalent discoloration as well as individuals. Facial discoloration, color. What color is mentioned there? Discoloration, any colors mentioned? And I noticed one color that is red somewhere. Yeah, a red round face. So that is the only color which I have seen here. Any other colors mentioned? I don't think so. Yeah. Yes, Shetu, Marina, Akila, total bilateral adrenalectomy. And what about the next question? The very next question, I mean last question. Prevalent facial discoloration observed in individuals with Cushing syndrome. So that answer is, I think, red, right? Yeah, red. I'm sure. Yes, Adira, Marina, which is red. Yes, Akila, which is red. Everything seems red, right? My dress and yes, that particular color which I'm using here to write. Yeah, everything connected. So red. And that's that. Next one, which is fill in the blanks. So first question. The salivary cortisol test assesses cortisol levels in a late night dash to determine if they are elevated. Salivary late night elevated which means increased. So yes, Melvin, Nimi, Umi and Shetu, Atulya, Akila, answer is red. And what about 15th question? What about question number 15? Salivary late night elevated. What is the missing word there or missing words there? And I think answer is mentioned in text B. Maybe in text B. Yeah, saliva sample. In text B, they've mentioned something related to salivary cortisol measurement. And this test measures the level of cortisol, keyword, in a saliva sample that has been collected late night, keyword. So too high, elevated. So answer is saliva sample from, yeah, text B. Answer is saliva sample. 16th one. To address the dash causing Cushing syndrome, medical or surgical adrenalectomy is required for healing. So that I'm going to underline. Address, medical, healing. Again, answer, I think healing, adrenalectomy. So I think it's in text D. So I'm just going to text D. Yes, Shetu, saliva sample. Marin, it's not cortisol, dear. It is saliva sample. Yes, Atira. Yes, Nami, it is saliva sample. Not saliva, dear. Saliva sample. Yeah, okay. So, the next one, which is somewhere mentioned here. I think in text D, right? Ectopic surgical resection or tumor. Yeah, that is in the keyword as a keyword it is mentioned there. Malignant adrenal enzyme inhibitors and indolent tumor, medical or surgical adrenalectomy. So I think answer is indolent tumor. Not I think, I'm sure. So answer is indolent tumor from, yeah, indolent tumor from text D. 17. The occurrence of Cushing syndrome is notably less frequent in dash. Notably less frequent. And where is the answer mentioned? Occurrence of Cushing syndrome is notably less frequent in dash. Less frequent in, I don't even have to read that. Men, women, children. So it is least in children, right? So answer is children, I think. Cushing syndrome, each cases year occur. 10%. See, very least. And although they develop, it is less frequently than adults are to children. So that is children. Answer is children. And 18, after the surgical resection, yes, not children's, children. After the surgical resection of a tumor, immediate dash is recommended for any residual carcinoma. Surgical resection, immediate recommended carcinoma. And 18th one, answer is mentioned in, again, text D. And that is mentioned in text D as, yeah, where is it mentioned text D? Transsphenoidal surgery, pituitary radiation, then surgical resection, carcinoma, keyword, immediate mitotain therapy. So that is, immediate is already there in the question, I guess. So that answer is mitotain therapy. Yeah, immediate is there. So that answer is mitotain therapy from text D. And second last one, Cushing syndrome is characterized by increased dash on the body or balding. Oh my god, a very direct answer, I guess. Increased what? Hair growth. That is what I've read there. So answer is hair growth. Right? Yes, Shetu, Marina, Nime. It is mitotain therapy, question number 18. 19 one is hair growth. And one of the symptom I've seen here, here, excessive hair growth on face, neck, chest, abdomen, breast and thighs, or balding. So answer is hair growth. And the last question, question number 20, cortisol plays a role in various bodily functions produced continuously and particularly heightened during dash. So cortisol role heightened. Yes, Shetu, it is hair growth. Yes, Nimi, Akila. Other not hair, dear, hair growth. And what about 20th question? During what? Some psychological conditions, right? Depression or stress. I think so. Somewhere I've seen that word. It's because of this. It's because of what? Cortisol is involved in many different parts of the body. It is produced all day and especially during times of stress. Yeah. So my answer is correct. Answer is stress. And that is mentioned in text A. So that's all about that. Yeah. So anyone with 20 out of 20 for this part? Time of stress. You don't have to write the time of stress, during which indicates the time. So answer is stress. All right. All right, guys. So, yeah, once again, all the very best. Write your exam. God bless you. Thank you.